and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we are very excited. We are getting ready for our Tongue Tie Conference of 2024. And with me here is one of our speakers, Trish Wierenga. Welcome, Trish. It's so good to see you here.
Hi, nice to meet you. Nice to see you today.
Wonderful to have you here. We are so excited about your presentation, and that presentation is titled The ABCs of Ankyloglossia and Perinatal Mental Health. Such an important topic. I just want to just jump one little bit back because I want to talk a little bit about yourself here and your journey. I know you are a nurse practitioner at IBCLC, so talk to me a little bit how you got interested and specialized in tongue tie here at this point as well.
Well, thank you. I'd love to talk about that. So I started off my career actually as an oncology nurse, and then I had a couple of children, and I got to be really good friends with our lactation consultant there at the hospital. And when I had my third child, my husband actually said to me, "No, I think you'd be a really great lactation consultant." And that was back in 2005. So it took me a good number of years. I ended up being able to sit for the IBCLC exam in 2011. And then that child actually that kind of propelled me into the IBCLC world ended up with a lot of speech difficulties and things like that. And at about 3 years old, we had thought he was diagnosed with apraxia of speech. And we
Mhm.
ended up doing a full, like, 3 week long intensive speech therapy camp. And it helped some. But by the time he was 8 years old, I was actually a lactation consultant at that point. And finally, with kind of new eyes, saw a picture on my fridge. And I'm like, oh no, what did I miss? Like, I just could tell at that point that he probably had a tongue tie. And it's interesting because I, as a lactation consultant, had now been working with families and seeing the real change that really good habilitation by lactation and breastfeeding management work plus frenectomy as needed really helped these families achieve the goals that they had wanted to meet. I ended up taking that now 8-year-old child to a dentist up in the Chicagoland area, and he was released at that point. And 4 months later, with a little bit of extra speech therapy, he was speaking completely normally. So he's really
Mhm.
my drive to learn more. I then went to my very first IATP conference, International Affiliation of Tongue Tie Professionals conference, and that was in 2014. And it was the first time that I had been in a room of multidisciplinary practitioners. And I say this all the time, but not a single one of us thought each other was nuts. And it was such a good, it was such a really good validating time, right? So then I
Mhm.
kind of got a little bit more involved and learned more and was able to reach out to some of the providers that are really doing a lot of research in this space and became friends with them. I ended up going to the second IATP conference, and lo and behold, I was asked to be part of the board of directors and then now the chairperson. And so I have a lot of a lot of friends that are really good practitioners in a multidisciplinary way across the globe. And how lucky am I to be able to do that?
I love what you just said about also about the multidisciplinary, approach there. It's fascinating, and I love to see how practitioners work together as a team. Talk to each other, educate, learn from each other too. Refer to each other. I mean, what a difference than compared to working in a silo, each practitioner for themselves, trying to figure things out, not knowing, how to improve things. That's absolutely fabulous to have that collaboration with other practitioners, right?
Yeah, absolutely. And I got to a point where those of us that are lactation consultants are really very knowledgeable in this
Mhm.
space. But we are unable to diagnose and refer, and there's a lot of talk surrounding that. And so then I decided, and I was able to go back to school to be a nurse practitioner, and so now I can do those things that as a lactation consultant I was unable to do. So like
Mhm.
I can diagnose now, and I can refer to people that know how to help me as a lactation consultant with the breastfeeding management and habilitation, pre-work, post-work. We can work really well together as a team.
Fantastic. Perfect. Now let's talk about your presentation. It's all about you. You added a part here that is so important and not talked about enough. And I'm talking about perinatal mental health. What a big topic. And I'm so glad you were presenting on that during the
Yeah.
conference there. I'm glad we're talking more about it, in recent years, but there is still so much work to be done, right? So much work to be
Mhm.
done. So tell me a little bit about that, and especially when it comes to ankyloglossia and what IBCLCs and practitioners, should keep in mind, and what can be done here? How can we improve?
So I think it is really important. I know that, back when I was in nursing school, a long time ago, I really didn't enjoy learning about mental health. But then becoming a nurse practitioner and being a lactation consultant, um, as a lactation consultant, we are screening our families for perinatal mental health issues. And I don't really think maybe are aware of it all the time, that we are doing that, I think, without even really knowing it.
Mhm.
And we are talking to them and we're helping them through some of these feeding challenges. Well, we know that feeding difficulties really increase the risk of perinatal mood and anxiety disorders. And I think that we need to really focus on that in a multidisciplinary way. Lactation, your primary care providers, those of us that are really working in the ankyloglossia world, we see families come into our offices and they are tearful and they are
Mhm.
um, sometimes crying because they're really happy that we're helping them and getting things fixed up for them. But sometimes they are really tearful and struggling because they aren't finding the help that they need. And we just need to be much more aware. We need to be screening these patients. It's really easy to screen them. We can refer them to their primary care providers. We can refer them to a perinatal mental health specialist. But we just need to, I think, be much more aware of what these families and the challenges that they're going through to sometimes actually some of the challenges that we are unintentionally putting them in by helping with the breastfeeding management too. We just have to be aware of all of that. And I think more
Mhm.
education is needed.
More education is needed. And you mentioned it is easy to screen. However, and you and I talked a little bit off off camera about that. It
Mhm.
is also a way how to screen, right? I mean, there's
Yeah.
many providers who just, okay, slap in the form, let's do this. We have to do it because, we are required to. But what really happens to these forms, and what is the next step? It's not just done with just giving out a form and filling out boxes, right? So talk to me about this just a little bit here.
Right. I'll talk a little bit more about some different screening tools, but very commonly throughout the perinatal world, the Edinburgh postnatal depression screening is the one that is used. It's a 10-question screening tool. Unfortunately, it is an older screening tool, but it is validated for use in both the birthing person and also their partner as well. Um, but we can actually use that screening tool across the board in many different settings. So an OB setting, a pediatric setting, lactation setting, community resource settings. But there is actually a tool that we can use that's an even shorter version of that that I think will make it more accessible for people. And I think in our screening of seeing our patients for the first time, it would be really easy to add a short form of this to our intake forms, our health histories, things like that, and that will just get the ball rolling on a
Mhm.
conversation that you can have in the office with your
Absolutely.
patient.
And I know you will be sharing that during the
I will.
presentation, right, Trish? And another thing you will be sharing, is a wonderful resource list. I can't wait for that because I know our viewers in the conference will appreciate that. And your presentation is so chock full of great information, plus videos, plus
Yeah,
interactive elements. Thank you so much, Trish. I can't
you're
wait for
welcome.
this presentation to come. And thank you so much for being here with us today to talk to me about all that you do in your work and also about the great presentation you have lined up for us at the Tongue Tie Conference here.
Excellent. I am really excited to be doing this for Gold. I think it's going to be a great time of learning, and I appreciate everything that you do.
Thank you so much. And now some information for our viewers as well. If you are interested to find out more about this presentation and all the other fantastic presentations in the conference, we invite you to go to goldtonguetie.com to find out more. We are live in September. We have 2 keynote presentations that are open access that you can also sign up there. If you go to the website, you find all the information about that as well. And I hope to see everyone at the conference. Bye-bye, everyone.